An ELISA is a medical diagnostic test used to screen large numbers of patient serum for the presence of antibodies to a microorganism. In this lab, we're testing indirectly for the presence of the pathogenic microbe by detecting the presence of antibodies. ELISA is used to detect viral infections, such as HIV in patients. Because you're testing for the presence of antibodies, the test may not be accurate if used too soon after exposure. There may be insufficient titers or levels of antibodies for detection. Please note that ELISA protocols may vary slightly by such things as the number of samples analyzed, the microtiter plate size, the method of removing reagents and wash buffer from the wells, the binding or incubation times, the number of rinses performed between reagents, and the color used to indicate a positive result. The serum samples from two patients, patient A and patient B, will be tested for the presence of antibodies. Label the outside of each well in your 12-well strip. Label the first 3 wells with a positive sign for the positive controls, and the next 3 wells with a negative sign for the negative controls. The next 3 will be labeled with the first patient's number or initials, in this case A, and the last 3 label with the final patient's number or initials, in this case B. If there are more than 2 patients being tested, label accordingly. Using a micropipette and sterile micropipette tips, add 50 microliters of purified antigen from the green tube into all 12 wells. Wait 5 minutes while the antigen binds to the plastic wells. The hydrophobic amino acids will bind to the polystyrene plastic wells. Wash unbound antigen out of the wells by tipping the strip upside down onto paper towels so that the samples drain out. Then gently tap the strip a few times at different locations on the paper towels. ELISA protocols may vary by the method of removing reagents from the wells. Cross-contamination may occur while tipping of the wells or tapping the paper towel. Therefore, reagents and wash buffer may be removed by directly pipetting the solution out of the well to minimize the risk for cross-contamination between wells. Discard wet paper towels. Using a disposable transfer pipette, fill each well to the top with wash buffer, taking care not to spill over into neighboring wells. The same transfer pipette will be used for all washing steps. Use care, however, to ensure that the tip does not touch inside of the wells to prevent cross-contamination of samples. The wash buffer contains a blocking agent, such as the detergent Tween, to coat the wells where antigen did not bind. This reduces the chances of non-specific binding of other reagents. Again, tip the strip into paper towels to drain the wash buffer out, and tap a few times on clean paper towels. Some bubbles, however, may appear in the wells due to the presence of the detergent, and that's fine. This will not affect the results. Use a micropipette and sterile tips to transfer 50 microliters of the positive control from the stock tube into the 3 positive wells. Use a micropipette and new sterile tips to transfer 50 microliters of the negative control from the blue tube into the 3 negative wells. Finally, use a micropipette and new sterile tips to transfer 50 microliters of each patient's serum sample into the 3 appropriately labeled wells for patient A and B. Wait 5 minutes to allow the serum antibodies in the samples to bind to the antigen. Empty the wells by tipping the strip onto paper towels. Wash the samples out of the wells by filling each well with wash buffer and then tipping it out onto clean paper towels. Tap the strip down several times, each time on a clean spot of the paper towel to prevent cross-contamination between wells. Using a fresh pipette tip, transfer 50 microliters of secondary antibody from the stock tube into all 12 wells of the microplate strip. Use caution to prevent cross-contamination between wells. It may be helpful to count off wells and offset tubes after the secondary antibody is added to prevent duplication. Wait 5 minutes for the secondary antibody to bind to the primary antibody. Wash the unbound secondary antibody out of the wells by repeating the wash step. The final step is to add a substrate specific for horseradish peroxidase. The substrate is called Tetramethylbenzidine, or TMB. The horseradish peroxidase will oxidize the TMB, turning it from a colorless solution to a blue solution. Use a fresh pipette tip to transfer 50 microliters of the substrate from the brown tube into all 12 wells of the microplate strip. Wait 5 minutes. You will gradually begin to see the blue color appear in the positive control wells, as well as the patients that have been exposed to the pathogen. Observe your results. The positive control should all turn blue. Please remember that ELISA protocols may vary slightly by such things as the color used to indicate a positive result. The negative control should remain colorless. The patient's samples should show positive or negative results. If the negative control appears blue, or the positive control is colorless, then the patient test results will not be accurate. In this case, the patient's samples will need to be retested. If the patient's samples turn blue, this is considered a presumptive positive for the presence of HIV or pathogen. Typically, further testing will be performed for confirmation.